In addition to 2 to 3 daily servings of green leafy vegetables, berries are considered a healthy choice for the preservation of eye health. As we age, our critical retinal pigment epithelium layer starts to break down. However, we may be able to decelerate that aging with blueberries. Human RPE cells bathed in blueberry anthocyanins had fewer free radicals and a lower proportion of aged cells, suggesting that blueberries and other red, blue, and purple pigmented fruits and vegetables may help prevent age-related macular degeneration. Protective properties have also been demonstrated in vitro on RPE cells from purple sweet potato anthocyanin, as well as the yellow pigment in turmeric and in amla extract, Indian gooseberry. However, the only human interventional trials on berries for vision were a month-long trial of a bilberry extract that demonstrated significantly less eye strain after iPad use compared to placebo, and a study showing 3 weeks of blueberry juice or freeze-dried blueberry powder both significantly improved photostress recovery time, which is a time needed to recuperate visual acuity after bright light exposure, by about 5 seconds. Only one pigmented food has been put to the test in macular degeneration patients, though, the spice saffron. Saffron is so potent that the whole spice can be stuffed into capsules to pit them head-to-head against placebo. Those with early-stage age-related macular degeneration were randomized to a tiny pinch, 20 mg, about 8 threads of saffron, versus placebo for 3 months. Compared to the placebo group, the saffron group experienced a significant improvement in retinal flicker sensitivity. That's our ability to pick out high-frequency light pulses rather than seeing the flickering light as a steady beam. That diminishes with age. It's a sensitive test of retinal function, but is of questionable clinical value. However, there was a small improvement in visual acuity in 80% of the saffron subjects, being able to see one line farther down on an eye chart, versus none improving in the placebo group. This is particularly important for those with age-related macular degeneration, for whom vision tends to get worse over time, not better. What about a more substantial pinch, 50 mg, about 20 threads? Compared to placebo, 3 months of this larger dose led to a similar improvement in visual acuity in macular degeneration patients, suggesting more is not necessarily better. Saffron is the most expensive spice there is, selling for about $200 an ounce, so being able to get away with a 20 mg dose, about 15 cents a day, rather than a 50 mg dose, closer to 40 cents a day, could add up over the long run. Even smaller doses may work too, but just haven't been tested. What about the tiny pinch over a year instead of just 3 months? Early-stage macular patients were given 20 mg of saffron a day for an average of 14 months, and average visual acuity improved by 2 eye chart lines. They also reported an improvement in contrast and color perception, reading ability, low-light vision, and overall quality of life. The problem is the study lacked a control group, so it's hard to put much stock in subjective measures of improvement. Interestingly, a 6-month randomized, double-blind, placebo-controlled trial found no objective acuity improvement in either placebo group or a 30 mg a day saffron group, yet reported that the patients unwittingly in the saffron group gave subjective reports of better vision and general well-being. The researchers suggest this may be an antidepressant effect, and indeed a meta-analysis of a dozen randomized, double-blind, placebo-controlled trials of saffron for depression found it beat out placebo and was found comparable to antidepressant drugs. The largest saffron vision trial to date was a double-blind, placebo-controlled crossover trial in which 100 older adults with mild or moderate age-related macular degeneration were randomized to 20 mg of saffron a day or placebo for 3 months, then switched to the opposite group for an additional 3 months. When on the tiny daily pinch of saffron, there was a significant yet modest improvement in visual acuity, and this was the case for both those on and off best practice therapy, the beta-carotene-free ARED supplementation, suggesting an additive benefit.